Thank you, Deputy Speaker. My adjournment matter this evening is for the Minister for Health, and the action I seek is to fund the Royal Flying Doctors Service Community Transport Program beyond June 30 of this year. Deputy Speaker, the Royal Flying Doctors Service Community Transport Program offers a vital service to community members aged over 65 to go from home to health appointments. Now, we know that being out in electorates throughout the Mildura electorate, but right across regional and rural Victoria, healthcare can be quite some time away. Driving those distances for those over 65 can be quite troublesome. And I actually had the absolute pleasure of running into a driver, Pat, and Mrs Machos, who's been a user of this service in Robinvale for quite some time. I ran into them down the street last week. And Mrs Machos is a huge fan of this service. Her and her husband use it often. They are elderly, but she's so full of joy when she speaks about this program because of not only the ability for her and her husband to get to health appointments from Robinvale and Euston to Mildura most of the time, but it's also the social connection. And that's what the volunteer drivers also tell me, because this program is completely volunteer-led. But it does cost money. These brilliant programs such as this do cost money. And we've heard, and I have raised in this House multiple times this year, that the Victorian Transport Patient Assistance Scheme is problematic at the moment with the length of time it takes for applicants to have their forms resolved. It can take now up to 8 months. So I am asking for the Minister to fund the Royal Flying Doctors Service to the tune of $2 million. That'll keep it going in the 10 communities: Robinvale, Warwick, Nabil, Cobram, Heathcote, Lakes Entrance, Sale, Newmerka, Foster, Central Gippsland, St Arnaud and Rochester. That $2 million, which doesn't seem like a lot, we'll keep this program going in those 10 communities, which is vital, because without this, people would not get to their healthcare appointments. $8 million, however, would be able to fund the Royal Flying Doctors Service to take this statewide and allow access for other places where there is still a big gap. So the Royal Flying Doctors do an amazing job at this community transport program. The drivers get just as much out of it as the clients do, and I urge the Minister for Health to fund this program and give assurance to those involved.